Hello, my name is Kavita Sao and I work at Counseling and Psychological Services at the University of Central Florida. Today is World Mental Health Awareness Day, and I'm sitting here with Brett, one of our therapists here at Counseling and Psychological Services. Brett, can you tell us a little bit about yourself?
Sure. So I am a master's student here at UCF. I'm getting my degree in clinical psychology. I'm one of the master's level trainees here. And again, my overall goal in life is to become a therapist. I want to be a psychologist, so I'm happy to be here.
Okay, thank you. So this year's theme for Mental Health Awareness Day is suicide prevention. What are some of the myths that are related to suicide?
Sure. So one thing that I notice a lot of in social discourse is we don't talk about suicide. We treat it as this taboo topic that is not only dangerous to talk about, but something that is uncomfortable to talk about. And I can see that, and at the same time, when I look at the data as a therapist, what we see, especially among college students, is that suicidal ideation happens to a lot of our population, roughly 30%, given some of the research. And I think we can take that and use it as a way to normalize conversation, that despite our impulses or feelings about the topic, it really is something that happens to a lot of people. And using that, I think we should talk about it. We should explain our experiences with those feelings of hopelessness or loneliness, and through that connect with one another and share our own experiences. And kind of spinning off that, one other myth I hear a lot is, well, if you talk about suicide, it's going to make people want to do it more, or it's going to increase the thoughts. And in my experience, just working with students who struggle with that, that's not the case. When you ask, are you having thoughts about killing yourself? Are you having thoughts about, not waking up? And there's a sense of relief. And I really think people feel bottled up and unable to talk about it. So the more we do talk about it, that relief, that just sense of I'm not alone, really is powerful for individuals struggling with this. So I think, again, it's more common than we expect, and talking about it does more good than I think we give it credit for.
Okay. So what do you think, not just the UCF community, but as a community as a whole, what do you think we can do?
So I think being aware and noticing certain signs or behaviors that are, different, or maybe off the beaten path from what you notice your friends or family doing, whether if they are becoming more isolated, or if they're talking to you less, or if they seem a little bit disengaged, that we take that uncomfortable step and we ask. And especially on college campuses, one thing we struggle with is a lot of people who have these thoughts, they don't seek out counseling. And so we really feel dedicated and want to utilize our communities to talk to these individuals because we aren't getting the opportunities to. And so, I challenge a lot of our community to step out and ask those questions of how are you doing? And really ask, how are you doing? Are things bothering you? And to share your experiences and to bond with one another. And even if the person seems a little bit distant or resistant, that's having an impact on them. That showed that someone cared. Someone took time to talk to me and to really ask and see how I'm doing. And it's those small steps, it's those small connections that get people to our door, that allow us to give them help. And it really boils down to us as a community extending that hand of empathy and connecting with people that we think we need, and to follow those intuitions and be brave and ask difficult questions.
Okay. Thank you very much.
My pleasure.